1,221 days ago, WHO learned of a cluster of cases of pneumonia of unknown cause in Wuhan, China. On the 30th January 2020, on the advice of an emergency committee convened under the international health regulations, I declared a public health emergency of international concern over the global outbreak of COVID-19, the highest level of alarm under international law. At that time, outside China, there were fewer than 100 reported cases and no reported deaths. In 3 years since then, COVID-19 has turned our world upside down. Almost 7 million deaths have been reported to WHO, but we know the toll is several times higher, at least 20 million. Health systems have been severely disrupted, with millions of people missing out on essential health services, including life-saving vaccinations for children. But COVID-19 has been so much more than a health crisis. It has caused severe economic upheaval, erasing trillions from GDP, disrupting travel and trade, shattering businesses, and plunging millions into poverty. It has caused severe social upheaval, with borders closed, movement restricted, schools shut, and millions of people experiencing loneliness, isolation, anxiety, and depression. COVID-19 has exposed and exacerbated political fault lines within and between nations. It has eroded trust between people, governments, and institutions, fueled by a torrent of mis- and disinformation. And it has laid bare the searing inequalities of our world, with the poorest and most vulnerable communities the hardest hit, and the last to receive access to vaccines and other tools. For more than a year, the pandemic has been on a downward trend, with population immunity increasing from vaccination and infection, mortality decreasing, and the pressure on health systems easing. This trend has allowed most countries to return to life as we knew it before COVID-19. For the past year, the Emergency Committee and WHO have been analyzing the data carefully and considering when the time would be right to lower the level of alarm. Yesterday, the Emergency Committee met for the 15th time and recommended to me that I declare an end to the public health emergency of international concern. I have accepted that advice. It's therefore with great hope that I declare COVID-19 over as a global health emergency. However, that does not mean COVID-19 is over as a global health threat. Last week, COVID-19 claimed life every 3 minutes. And that's just the deaths we know about. As we speak, thousands of people around the world are fighting for their lives in intensive care units. And millions more continue to live with the debilitating effects of post-COVID-19 condition. This virus is here to stay. It's still killing, and it's still changing. The risk remains of new variants emerging that cause new surges in cases and deaths. The worst thing any country could do now is to use this news as a reason to let down its guard, to dismantle the systems it has built, or to send the message to its people that COVID-19 is nothing to worry about. What this news means is that it's time for countries to transition from emergency mode to managing COVID-19 alongside other infectious diseases. I emphasize that this is not a snap decision. It's a decision that has been considered carefully for some time, planned for, and made on the basis of a careful analysis of the data. If need be, I will not hesitate to convene another emergency committee should COVID-19 once again put our world in peril. While this emergency committee will now cease its work, it has sent a clear message that countries must not cease theirs. On the committee's advice, I have decided to use a provision in the international health regulations that has never been used before, to establish a review committee to develop long-term standing recommendations for countries on how to manage COVID-19 on an ongoing basis. In addition, WHO this week published the 4th edition of the Global Strategic Preparedness and Response Plan for COVID-19, which outlines critical actions for countries in 5 core areas: collaborative surveillance, community protection, safe and scalable care, access to countermeasures, and emergency coordination. For more than 3 years, the experts on the Emergency Committee have devoted their time, their experience, and their expertise not just to advise me on whether COVID-19 continues to represent a global health emergency, but to also advise on recommendations for countries. I would like to express my deep gratitude to all the members of the Emergency Committee for their thoughtful consideration and wise advice. I thank especially Professor Didier Ussa for his leadership as chair over the past 3 years. He has led the committee with a calm demeanor and a steady hand through turbulent times. I also wish to thank the incredible people who I have the privilege to call my colleagues. For more than 3 years, the people of WHO have labored day and night under intense pressure and intense scrutiny. They have brought together partners and experts from around the world to generate evidence, study and translate it into guidance and actions for the world.